Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McCrae.
Mayo Clinic researchers are launching a study to find the best individualized treatments for alcohol use disorder, what you and I know as alcoholism.
Drawing from the disciplines of psychiatry, genetics, pharmacogenomics, artificial intelligence, and metabolomics.
Meta who?
Metabolomics. We'll find out.
Hopefully he'll explain that.
To conduct this study, researchers will look at how an individual's genetic makeup affects their response to drugs needed to help alcoholics stay sober. Interesting. And here to discuss the study is co-principal investigator, Mayo Clinic psychiatrist, Dr. Victor Karpyak. Welcome to the program, Dr. Karpyak. I'm so happy to meet you.
Well, thank you. I'm delighted to be here.
This is really interesting. But it makes perfect sense that a person's genetics or their alcoholism would be affected by their genetics.
Absolutely. Evidence shows that genetics contributes between 40 and 60% of vulnerability to alcohol use disorder. It's pretty significant compared to other conditions, but we should remember that it only becomes significant when people drink. It's not a fatal predisposition.
So you're saying that if you have a family history, for example, of alcoholism, you're significantly at higher risk for having it yourself?
At least 40 to 60% higher compared to those who don't have this family predisposition. That's true.
Well, it's sort of interesting, isn't it? Because when you hear people, reformed alcoholics, you often hear them say, my dad was an alcoholic or my mother was an alcoholic. So it makes sense.
Well, absolutely. People were aware of that even before we became,
More
armed,
sophisticated.
and armed with ability to actually look at genetic code itself.
How common is alcoholism?
It's quite common, depending on the definition of what alcoholism is, which tends to evolve throughout years. You can say that between 7 and almost 30% of people who live in the United States suffer from alcohol use disorder.
How many? Say that again. How many percent?
Well, according to the older classification, which was looking only at severe cases, it was only 7% of people who met criteria for alcohol dependence. However, most recent classification, which is called DSM-5, which has less restricted criteria, tells us that 29+% of people who live in the United States at any point in their life may have been or will be or currently are suffering from alcohol use disorder.
1 out of every 3 people, almost.
That's correct.
Incredible.
It is.
And it seems like binge drinking, particularly on college campuses and among younger people, not that we didn't drink when we were in college, but binge drinking seems to be a bigger problem than it used to be.
It is certainly a bigger problem. However, we can't say that everybody who binge drinks actually meets criteria for alcohol use disorder. Having said that, I have to emphasize that this is one of the ways to actually become addicted and meet criteria for alcohol use disorder.
Is binge drinking?
It is.
One of the steps.
Makes sense. Why are people hesitant to get treatment? I mean, if it's so common, 1 out of 3, then it would seem like you'd say, well, I've got support all around me.
There are several different reasons. One of the most commonly reported reason is that people don't think they have a problem. The other reason is when problem becomes more obvious is a sense that they can overcome the problem by themselves. This is where stigma comes in, because sometimes people don't feel comfortable talking about their problems, and problem tend to continue its presence and actually may develop further. Even after people realize that they need help, they look at treatment outcomes, and this is where when they hear that medications don't help everybody, they tend to step back and ask if this medication may help me. Mm-hmm. And that's where we are trying to help those people who want treatment to decide if particular type of medication is the right choice.
And that's where the pharmacogenomics piece comes in. Explain what that means.
Pharmacogenomics is a new area of medicine which already proven itself useful in parts of medicine which is focusing on cancer or cardiology problem or even psychiatric problems like, for instance, depression. In those areas of medicine, researchers were able to demonstrate that knowing specific variation in a genetic code allows to predict whether a particular type of medication may actually help this person who have this particular variant, and for those who don't have the variant, which is predictive of positive response, obviously decisions should be made about looking for a different type of treatment option.
So what you're really trying to do is base your treatment regimen on what you learn about the patient's genes.
That's correct. Genes are stable, they don't change, and knowing it ahead of time, specific type of genetic variants, if it is predictive of treatment response, may allow us to reliably predict who will and who will not respond to particular treatment.
So you're not able to do that now, but hopefully this study is going to help you be able to do that?
That's exactly why we are funded to do this type of study.
And what is your success rate now, and what do you hope it might be if you can match genes to treatment?
Based on the studies which were included by Food and Drug Administration in approval of acamprosate, which is one of 3 drugs approved for treatment of alcohol use disorder, it's between 1 in 8 to 1 of 12 people who respond to treatment with this medication. This is not much different from success of treatment with antidepressants when we're treating depression or anxiety. And
it's pretty low.
Well, it seems low, but what I'm trying to say, it is actually not much different from the other medications which are blockbusters like selective serotonin reuptake inhibitors or SSRIs.
For depression.
For treatment of depression. Mm-hmm. It's actually much better than many treatments which are recommended for control of blood pressure or HIV or other quite commonly used medications. So this misperception of number needed to treat, which I shared with you, is again among reasons why people tend to be hesitant selecting particular medication. So what we hope to do is to be able to identify those who will respond and tell others about different options. But for those who will have biomarkers predictive of response, of course, the numbers will be very different.
What is metabolomics?
Yeah, finish it up with that, because neither of us really understand.
Okay. Metabolomics is a fancy word which is used to talk about patterns of metabolites, which can also be predictive of particular phenotypic characteristics, or to put it in more common language, if we know that a combination of particular types of metabolites in patient's blood is predictive of his or her ability to respond positively to particular medication, this is another biomarker which can allow us to properly select between potential responders and non-responders.
So you're getting pretty sophisticated.
We are.
When do you think we might have some results from your study so that you can actually match treatment to genetic makeup?
Well, we are funded to do 2 studies which will help us to identify both genetic and metabolomic biomarkers associated with treatment response to medication, which is called acamprosate. We are funded to do it in 5 years. we expect that biomarkers will be identified, and that will allow us to move forward with validation studies and studies which will allow us to assess how reliable is this prediction.
Well, it sounds like the sooner the better, because there are a lot of people out there who need your help.
I agree.
All right, personalized treatment for alcohol abuse with Mayo Clinic psychiatrist Dr. Victor Karpyak. Thanks so much for being with us.
My pleasure.